There we go. Okay, so continuing our talk about answering the OASIS MOOC questions correctly to get the most effective answer, the most accurate answer, so that when we're coming back in at discharge, we're able to show progress, we're able to show that the patient improved, we're able to show that what we did was effective for this patient. So today we're going to be talking about the transfer question, and I know this is one that has tripped up a lot of people for a long time. So we're going to kind of demonstrate the way that to ask this question and what you observe and how to answer it correctly. Okay? Okay, so you've got a patient. We've got Miss Sanders here. She's sitting in a chair, which 99.9% of the patients you see are going to be sitting in a chair. I mean, we just don't go in and see that many bedbound patients. Because if they're bedbound, this question is going to be easy to answer. So they're sitting in a chair. We're going to say, okay, Miss Sanders, can you get up out of this recliner that you're sitting in?
Yeah, I can if I use my cane.
Okay, let's see you stand up.
That's about the truth, Sue.
It's a metal thing.
Okay, good. So, observing Miss Sanders stand up, what do we know that she's going to require in order to do this safely? Assistance. She's going to need somebody there, right? Whether I have to actually lift her out of the chair or not, according to the OASIS guidelines, somebody being right here close is minimal assistance. That it's a requirement for her to do it safely. So if we're looking at the questions, with a 0 is that the patient can transfer without any device, any assistance, 100% independently and safely. Is that what Miss Sanders can do? No. So let's look down. We look at a 1. Now this is where it gets tricky. With a 1, the question says the patient can transfer with minimal assistance or an assistive device. Okay? Now that's a key point. Somebody look at that real quick. Make sure I'm saying that correctly. It doesn't sound right when I said it out loud. But if they require, they have to require one or the other to be a 1. If they require both, they are a 2. Okay? If they require an assistive device and minimal assistance, they are a 2. So essentially, a 1 is what you would score a patient that's independent with transfers using a device. Okay? They can get up without any help, without anyone there. They can do it safely, but they use a cane or a walker. That's a 1. If they don't use an assistive device, but they need somebody to make sure they're okay once they get standing up, that's also a 1, because the question is or, not and or and. It's an or question. So you have to take that exactly how it's worded. Is that how it's worded? So yeah, a 1, able to transfer with minimal human assistance or with the use of an assistive device. Now, when we start looking down at a 2, okay, now we're looking at the patient is able to bear weight and pivot but cannot transfer themselves. Okay? That may not sound like the correct answer for this particular patient, for Miss Sanders. Or you may be thinking, well, they can stand up, they can pivot, they can do that. So, well, they've got to be a 1. If they don't meet the criteria for the higher score, then they automatically are scored below. So by default, you are going to score this patient a 2. Now, scoring a patient a 2 for transfers is not only is it the correct answer, but it gives us room to show improvement. Even if therapy is not involved in a patient at all, let's say you're an RN and you're going and you're doing an assessment on a patient that's got a leg wound that's giving them a lot of pain. And they just can't get up out of that chair because it hurts for them to bear weight. Therapy's not involved. The doctor doesn't want them doing any kind of activity that's going to impair the healing of that leg. you work on this wound and in 8 weeks it's healed or close to being healed and it doesn't hurt anymore. So you come in and do their discharge, you know, they're independent with taking care of the wound, and you're cutting out of there, and you go back and you go, well, I scored them a 2 when we started, but now they can get up on their own as long as they've got their cane. So now they're a 1. And now when you submit your OASIS, you have shown improvement. You've shown that you actually did something for this patient. Besides just healing up their wounds, you've improved their function. And therapy didn't even have to be involved in this. But, you know, of course it goes without saying that for a therapy patient, if we're pushing and pushing and pushing, trying to get this patient to be better with transfers, and we score them a 1 at the beginning and they still use that cane when we're done, or use that walker, then we haven't shown any improvement. Now, the lower questions, of course, are going to be for the patients that they absolutely, you know, cannot pivot, they cannot transfer, they require, you know, moderate to maximal assistance or the use of a lift or anything like that. And those last few are pretty easy and straightforward to answer. But it's the 0, 1, 2 questions that usually trip people up. Does anybody have any questions about that? One note about that, and this is important. The therapists, I think, pretty much all know this, but the nurses may not. If you score a patient a 3 in ambulation, which is the question that says they need constant supervision to ambulate safely, then a 2 is always the correct answer. You will get that coming back to you when you run your PPS Plus scrubber. It will kick it back to you that should be your correct answer. But if you score someone a 3 in ambulation, then by default they are a 2. Okay? Any questions? All right.
Thank you.